Borderline personality disorder, otherwise known as BPD, is a serious mental health condition and psychiatric diagnosis. It's called borderline because doctors previously thought it was on the border between two different diagnoses, and that's neurosis and psychosis. Now, it's also known as emotionally unstable personality disorder, or EUPD. And notice how this name includes what it feels like. Now, I'm going to continue to refer to it as BPD because this is how it's more commonly known and also how my clients refer to it. So BPD affects about 1 in 100 people. And of course, this includes people from all walks of life. No one is exempt. And that includes, therefore, the celebrities I'll be discussing. Also, it's interesting that BPD is thought to affect men and women equally, but is more often recognized in women, just as ADHD is more often recognized in men. So let's discuss this very important mental health diagnosis, using examples of celebrity who, despite their fame, also struggle with BPD or symptoms that may be consistent with a BPD diagnosis. We'll also learn about how BPD is managed by these individuals. So who are the 9 celebrities that I've selected that were either diagnosed or at least thought to experience BPD traits? 1 is Angelina Jolie. Jolie was thought to have been diagnosed with presumptive or suspected BPD in the late 1990s when she voluntarily admitted herself to a psychiatric facility due to suicidal and homicidal ideation. However, it is important to mention this has not been officially confirmed by Jolie. Now, despite her difficulties, Jolie is an award-winning actor, screenwriter, director, author, and humanitarian. Another celebrity thought to experience BPD is American actor Lindsay Lohan. This is in part due to Lohan's substance misuse problems, time in rehab, and her behavior at times. But again, Lohan has demonstrated, just like with physical health, mental ill health does not have to inhibit one's life. 3rd is the Princess of Pop, none other than Britney Spears. Now, she admitted to being diagnosed with the mood disorder bipolar. But why do I mention this when we're talking about the personality disorder that is BPD? This is to highlight the importance of not speculating and misdiagnosis, because so far I've spoken about suspected BPD. Indeed, Britney has shown symptoms that could align with BPD, like extreme impulsivity, like when she married her childhood friend in 2004 and then annulled the marriage after only 55 hours. She claimed at the time that she lacked understanding of her actions. We've also seen the footage of Britney acting aggressively and shaving her head. Now, she's also been admitted to rehab centres for substance issues, as well as the infamous conservatorship. So we must remember that different psychiatric conditions and their symptoms do overlap. And although we might suspect a particular disorder, we might be wrong, just as some doctors can be when they misdiagnose. But where's Britney now? Oops, she did it again. Britney's back with hit music and a tell-all memoir. Goes to show that her very serious mental health problems aren't stopping her. Today, many psychologists believe that Marilyn Monroe suffered from BPD due to her struggles with emotional instability, substances, impulsive behavior, suspected suicide, and because of a previous abandonment trauma, which can all be contributors to developing this condition. So I think it may well be a possibility, but I also think posthumous assessments should be taken with caution. Now, at the same time, it does make you wonder, would she have lived longer if she'd received a mental health diagnosis and some help. Our beloved and tragic Marilyn highlights the importance of gaining a diagnosis and support. 5 on the list is Amy Winehouse, the incredibly talented singer-songwriter who the UK newspaper The Times described as struggling with BPD according to doctors. Now, we're all probably aware of that sad tale and why BPD was diagnosed. Did you know, though, that her magnum opus Back to Black was about heartbreak, addiction and depression? Another life cut tragically short, this time perhaps because, as the documentary about her implies, her support network was not quite what it needed to be. So now let's talk about some men, because as I mentioned before, BPD is thought to affect women and men equally. These are some men that also were thought to have BPD, but maybe not diagnosed. So the mega-talented Dutch artist Van Gogh was thought to have bipolar, as well as traits of BPD. You may have heard about the artist cutting off his ear, but did you know the Starry Night reflects Van Gogh's view of the countryside from his window and his ruminations and feelings when he stayed at St. Paul Asylum in southern France? He was recuperating due to being plagued with depression. So for 7 and 8, let's talk about 2 American funny men and actors, Jim Carrey and Ben Stiller, who are both thought to have been diagnosed with BPD as well. Both have been very successful in spite of their difficulties, and they also highlight how we should never assume people who present as happy, jovial or gregarious are always okay. It really does remind me of the case of Robin Williams. Now this one is a bit of a curveball. She's not a celebrity in the strictest sense, but she's known for her work with BPD. Marsha Lane, the psychologist who created dialectical behavioral therapy, or DBT. It's the gold standard for BPD. And Linehan was diagnosed with BPD, and she did much work to help others with the condition. So BPD is experienced differently for those who have it, and they are thought to be 4 different types. But for diagnostic simplicity, psychiatrists have grouped the symptoms into 9 major categories. So for someone to attain a diagnosis of BPD, they must experience at least 5 of these symptoms, which should have been present for an extended period, and impact in different areas of life. So these symptoms are fear of abandonment, unstable relationships, an unstable sense of self or shifting self-image, impulsivity, self-destructive behaviors, self-harm, which includes suicidal behavior, extreme emotional swings, chronic feelings of emptiness, explosive anger, and feeling suspicious or out of touch with reality. So how do celebrities and others with BPD manage the condition? One useful way is therapy. Many celebrities are open about seeking therapy to manage their mental health. And for BPD in particular, this could be DBT, CBT, or counselling, as well as an integration of these. Now, some may choose medication to help them manage their difficulties. This should always be done under the guidance of a medical professional who can prescribe the right type and dose of medication for that particular individual's needs. Many people with BPD often find a strong support system very helpful in managing their emotional and mental health and well-being. Mindfulness practices such as those incorporated in DBT or coming from CBT can be helpful to some, but this really depends on the individual because it's not for everyone. And self-care routines are also very important for managing BPD and can be developed with the help of a therapist. or even with your loved ones. It must be incredibly difficult for those in the public eye when they have to manage a condition like BPD because of all the scrutiny they face and the lack of understanding and privacy. It's important, therefore, to destigmatize mental health issues, and celebrities can help raise awareness, although they shouldn't be pressured to. Ultimately, we all have a responsibility in these matters, and for something like BPD, there can be a heavy stigma due to the lack of awareness, which only adds to the difficulties for sufferers. So if you feel this way, I recommend therapy. Find a therapist that you're comfortable with, who can make your experience feel valid, as it most certainly is. In this video, we've briefly explored the difficulties of the serious and important condition that is BPD. Looking at celebrity examples will hopefully help to destigmatize BPD, because like with any other mental or physical health condition, we should treat those who suffer with empathy, kindness, and understanding. So please do feel free to share anything you're comfortable sharing in the comments, and let's continue this important conversation. Also, do share, like, and subscribe for more content on mental health awareness.